Hello, are you pregnant or planning to get pregnant and you are concerned about what sex in pregnancy would be like? You don't need to worry. Come close. Let's talk about sex in pregnancy. The first question that most couples or pregnant women would usually ask is, can I have sex in pregnancy? The answer on a general note is a capital yes. You can have sex and enjoy sex in pregnancy. But there are cases where the doctor would advise that you abstain from sex at some point in time, or probably, but in rare cases, throughout the period of pregnancy. Another question that a pregnant woman would usually ask is, will sex affect my baby adversely? It is a capital no. Sex will not affect your baby adversely. In fact, your baby naturally does not know what is going on when you have sex. Another common concern for pregnant women and couples is sex actually beneficial? Yes, we can say from research that sex during pregnancy is beneficial, especially to the pregnant woman. Number one, sex would help to relieve stress. Number two, sex would help to improve your mood. Number three, sex would help to improve your heart rate. And number four, sex would give you better sleep. All of these benefits would usually come with sex, especially if the pregnant woman gets to orgasm. Now, what are the concerns about having sex in pregnancy? At which point your doctor would usually advise that you have a pelvic rest or a coital holiday, by which I mean abstaining from sex over a scheduled period of time, over a prescribed period of time, or throughout pregnancy. There are a few instances. Number one, when you have bleeding after sex. Bleeding after sex. A few women will experience bleeding after sex. It is usually a pointer. If it is early in pregnancy, it could be a pointer to implantation bleeding. Number two, it could be a pointer to threatened miscarriage. Again, for women who experiences bleeding in pregnancy generally, recurrent bleeding in pregnancy, you would need to see your doctor, who would advise you appropriately with respect to abstaining from sex during pregnancy over a period of time, which is usually a very short time. Another category of pregnant women that would need to abstain from sex on the instruction of their doctor are those who have a history of recurrent miscarriages. A history of recurrent miscarriages is a risk to another miscarriage in an index pregnancy. So usually, because sex at that point in time, especially if it is vigorous or aggressive, will be a pointer to another miscarriage, the doctor would usually advise for a coital holiday. Number four, recurrent vaginal infections or sexually transmitted diseases. This is another instance that your doctor would advise that you abstain from sex during pregnancy. And even when it would give you the go-ahead to have sex in pregnancy in this condition, it is important that your partner would usually use a condom. Because recurrent vaginal infection or sexually transmitted disease in pregnancy would mean that you would usually infect him, and even after you've been treated and you are cured, he may reinfect you again in pregnancy. This would be a high risk for you and for your unborn baby. Issues with placenta would also be another reason that sex would pose a risk to your pregnancy. Normally, the placenta should usually be located far away in the womb, far away up in the womb, away from the cervix. But in cases where we have low-lying placenta or placenta previa, which can be diagnosed on clinical grounds, but more importantly, with the use of ultrasound scan, your doctor would advise that you stay away from sex for a period of time. History of premature labor or preterm contractions is another reason why your doctor would ask that you stay away from sex in pregnancy. Another common reason that your doctor would advise against sex in pregnancy is if the water bag of your baby starts to leak or it ruptures, what is called premature rupture of membranes. If you've had a recurrent history of this, or just one episode of it in your present pregnancy or in previous pregnancies, your doctor will be able to guide you appropriately about having sex in pregnancy. Now, let's talk about the peculiarities of each trimester with respect to sex in pregnancy. There are 3 trimesters in pregnancy. Pregnancy occurs for a period of 9 months. So every 3 months in your pregnancy is called a trimester. Your first trimester is the first 3 months. Your second trimester is the second 3 months of pregnancy. And your third trimester is the last 3 months of pregnancy. Now, in your first trimester, most women will experience mood swings, food cravings and aversions, nausea and vomiting. These would usually affect, to some extent, their desire for sex in pregnancy. But when the desire comes, when you have increased libido in your first trimester, then you can enjoy sex in pregnancy. And for your first trimester, your regular comfortable positions for sex can be employed. This is not an issue. In your second trimester, your baby bump starts to show. It means that your abdomen starts to gradually get bigger and it becomes pronounced. At this point, even though you are very energetic or you are more energetic in pregnancy, you would have to start to change your sex position such that pressure effect does not affect you and your baby. What are the positions that are allowed or that are beneficial or that will be comfortable for you? The regular missionary position may be okay if your partner would not rest his weight on you. That is one. Number 2, the reverse missionary position, where you as a pregnant woman is on top, is much more better. Number 3, lying side by side during sex will be better for you and for your unborn baby, because almost completely the pressure effect on your baby and your blood vessels is eliminated. Side by side, facing the man entry from the back, what is regarded as the spooning position. In your third trimester, the positions that you assume in second trimester should also be continued. Your baby bump becomes bigger and more pronounced than in the second trimester. But again, there may be mood swings, there may be apprehension about childbirth, about delivery. That is one. This could affect your desire for sex. Number 2, you have more of pressure effects. At this point, you start to have low back pain, lower abdominal pain, pressure on your bladder, you tend to urinate more. These are things that could affect your desire for sex, especially when it becomes prolonged. But sex is not supposed to be enjoyed in pregnancy. Sex is supposed to be enjoyed in pregnancy as long as there are no risk factors when the doctor will prescribe a no to sex for a period of time. So as much as possible, the onus lies on you and your partner to discuss the issue of sex in pregnancy, and when there are concerns, it is time to report to your doctor ASAP. Remember, sex in pregnancy is very, very beneficial. Continue to enjoy sex in pregnancy as long as it is medically allowed. See you in the next video.